When a patient first gets diagnosed with breast cancer, it can be a very stressful time. There's a host of things that go through patients' minds, and it's really completely individualized from patient to patient. Everyone deals with this in a very different way. It's very hard. I haven't encountered a universal response necessarily. I think the interesting thing about breast cancer that's different than a lot of cancers is that breast cancer patients generally aren't ill, as opposed to a lung cancer patient or a head and neck cancer patient or even a brain tumor patient or a lot of GI tumors. Those patients generally are ill, have some inkling at least that they have something wrong. Most breast cancer patients actually, because most of them are diagnosed on a screening mammogram, have no sense that anything was wrong. So that's usually the first stress, is this feeling of, but I'm healthy, I shouldn't have this. And I think that it's important for family members to support them through that time, to help them to voice that frustration and that disbelief, and to at least hear all that. Then through therapy, it's important to be supportive. I mean, it usually means a lot of visits to the doctor, and if the patient herself has family that she's caring for, then she usually needs assistance with caring for that family, because regardless of what therapy she receives, there will be a component of fatigue involved. And doing all of the jobs that the woman usually does in the home, something usually has to give way, and she usually needs help whether or not she's willing to ask for it. So that's an important part of it. And throughout therapy, there will be ups and downs, and that's pretty challenging. In terms of dealing with the physical side effects, all of the usual things that your mother always told you are still in effect, meaning get a good night's sleep, eat a balanced diet, get exercise. All of those things really help a patient to get through. And a lot of times family needs to help with some of those things, encouraging them to exercise, helping them with food prep. All of those things are true also. And then after therapy's done, I think the other part that's important is that I hear from a lot of my patients that there's an expectation that once therapy is done, you should be all better. And now you should resume all of the roles that you had before, and let's just turn back the clock and put things back like they were a year ago, before you were ever diagnosed. And that's really hard on the patient, because I think the patient often has that same expectation of herself. I should be back to where I was. I should be doing everything I did before. I should feel the same as I did before. Why don't I? And it's normal to not. It's normal to continue to be stressed. It's normal to be still worried about the development of a recurrence. All of those things, I think, are normal. And it's normal to, the other part of it is that even though your hair may be grown back, or you may be done getting your radiation, your skin may be all better, you're still not completely 100%. You're not back to where you were. And it's very hard to get back to where you were. For a premenopausal woman that's gone through all of this therapy, oftentimes they become postmenopausal, and she's already dealing with the change in her body that occurs when she goes through menopause, and the slower pace at recovery, and then she has a bigger stress to recover from usually than she ever has seen in her whole life. I mean, pales even beyond childbirth. This is really a big stress to get over. So it's hard. It's a very much of an uphill climb, and it's not an immediate improvement. And that's really hard for family members to deal with sometimes. So I think that's the other important part of it, is that family members need to be patient with that, need to recognize that even though the therapy's complete, she isn't going to be exactly as she was.